This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, yet another case of pseudoexfoliation in an elderly male patient with a moderately dilating pupil. We can see this small shadow in between the iris and the pupil. This invariably suggests some degree of zonular laxity in my experience. And let's see how things turn out. So during staining of the capsule, I inject just a few drops of trypan blue under the iris beyond the pupil, so that the peripheral part of the capsule can also be stained a little bit, and then a few drops under the air bubble in the center of the antechamber. The chamber is refilled with OVD, and before implanting the pupil expansion device, I would like to stretch the pupil using 2 Y hooks. The stretching is done in 4 meridians, and I've induced a couple of microsphincterotomies because of the stretch, and now is the time to implant the pupil expansion device. In this case, I'm going to use the BX 2.0 version again. It is going to give us a better pupillary dilatation. And now is the time to test the health of zonules. The moment I touch the capsule, multiple radiating folds are seen, suggesting severe anterior zonular weakness. The flap is raised, and as the capsule is being torn, please look at these folds which are near the tearing edge. So an adequately sized rhexis is performed, and now is the time to perform an important step, that is hydrodissection. Very little fluid is used to perform the hydrodissection. The lens is decompressed to let out the fluid. There is a hint that there is some amount of corticocapsular adhesions. The decompression is done one more time to ensure that the corticocapsular adhesions are broken, and it is confirmed by doing gentle nucleus rotation. Time to emulsify the nucleus. Now, as I'm trying to aspirate the epinucleus, you can see that there's a lot of wrinkling of the anterior capsule around the probe, again suggesting that the presence of lax zonules. Now, because the hydrodissection has been effective, I'm able to move around the nucleus even in the presence of weak zonules. So the first chop is done, and again during rotation of the nucleus, I'm using the 2 instruments inside the eye to rotate it. So bimanual maneuvering does help to rotate the nucleus in eyes with compromised zonules. It's a very gentle way of rotating. It ensures that we are using the physical forces much more efficiently without causing any stress on the zonules or the bag. The nucleus is divided into smaller fragments, and each of the fragment is now being pulled out of the bag and emulsified in the supracapsular space. Time to remove the cortex. So cortex aspiration can be very tricky in these eyes with the generalized zonulopathy, and we need to be very cautious. There's also a risk of fluid misdirection happening in such eyes, so we need to be anticipating that problem as well and be mindful of a possible bulging posterior capsule. The last bit of cortex is aspirated, and so it would be helpful to use a tangential way of stripping the cortex in such eyes. Now before proceeding, I would like to place in the CTR. The strategy is again to place the CTR into the bag and then place a multi-piece lens in the sulcus and then achieve an optic capture. So this has been my strategy in such eyes with generalized zonulopathy with pseudoexfoliations. There are a couple of benefits. The number one and the most obvious would be a better long-term stability of the lens and centration. Number two would be lesser incidence of pseudophacodonosis. The BX device is explanted out, OVD both in front and behind the lens is irrigated out. Time to achieve the optic capture. The haptics are in the sulcus. The optic is gently tapped back. The ovalization of the rexus confirms the optic capture. I just reassure myself by retracting the iris back, and that's it, the case is done. The side ports are hydrated, and these are the first day post-op pictures. And these are the 5th day post-op pictures, and this is post-dilatation. The lens looks to be very well centered and stable. That was it. Thank you for watching and hope you found this helpful.